today we're going to talk about women and heart. And we have today in the studio Dr. Whelihan that is going to talk about women with a broken heart. Stay tuned.
Welcome to Senior Care Made Simple, an elder care podcast, your guide to navigating home health care with confidence. Hosted by Andrea Albertini, founder and CEO of Horizon Care Services, an industry leader in private duty home care in South Florida. To learn more, visit horizoncareservices.com.
Good morning, good afternoon, good evening. I am your host, Andrea Albertini, for Senior Care Made Simple podcast. And I am here today, again, with my amazing PR and co-host, Doris Muscarella. Hello, my darling.
Hello, dear. Hello, listeners.
Well, you know, you guys, she hasn't been in the studio for a while, so we've been having to have her virtual.
I'm here. I'm here.
And you know, I yelled at her the last time.
Yes, because of my lipstick.
I know. That was so funny. She had the readiest lipstick you guys could imagine.
I threw it away, okay? By the way.
Why would you do that for?
Never again.
Why? It looks so pretty. It looked perky.
Perky. It looked like an old lady.
You look so happy with that red lipstick. And today, we are very excited because we have our amazing guest that we love and we had so much fun with and we learned so much. And, you know, just for you guys know, I'm 61 years old. How old are you, Doris? 52?
I will not say that on the air for nothing in the world.
I do. But anyway, so today we have in the house again our favorite guest, Dr. Whelihan.
Oh,
Yay.
So glad to be here.
Yes,
we are so excited. We love having you here. The energy in the room just gets crazy. And then Doris, of course, she loves you. She knows you for a long time. So am I. And I hope you all listeners love her as well. But Doris is already like, this is my turn. I'm going to do all the work. So I'm giving it to you, Doris.
Well, Dr. Whelihan wrote this amazing article, and it's entitled, Are We Missing the Women with a Broken Heart? You have to read it. It's in her blog, and we're going to talk about it today. Thank you for being here. And to talk about this, and you apparently went to a Menopause Society annual meeting, and you came back all fired up to give us information.
Well, after 30 years of practice, it's really hard to get excited that you're going to learn something new at a meeting, right? So you always hope to glean one thing that will make it new for me. But let me tell you, this last meeting in October, the Menopause Society annual meeting, was chock full of great stuff, speaker after speaker. I was texting my husband, who is back in the room, saying, I'm staying down here for another one. I can't believe I've been in the seat the whole day. And they were in series of 3 speakers per topic. The speakers were all women, either researchers or physicians or both or PhDs. And one round of topics, which you're talking about right now, is heart disease and women. So notoriously, when we decided who should take statins for blood pressure, it was always patterned after male data. So we knew that if men took a cholesterol medicine, a statin, that it would lower their risk of heart attack by 50%. And so what did they do when women had high cholesterol? They just extrapolated that and said, well, women are the same, so we're going to give it to them. So these 3 speakers really started presenting data about some interesting findings that were unique to women, and how when women go to the ER with chest pain and they do a quick workup and they say, nope, you look good, everything's fine, and send you home, that perhaps it goes a little deeper and differently for women. And that's what this piece is about.
Oh, extremely interesting.
That's amazing.
And you know what? Also, when you go to I've gone to the hospital with chest pains, and they're like, okay, well, I do have anxiety and it's just exacerbated. Okay, go home, lie down, and you're dismissed.
True.
So when I read this, it's like, whoa, somebody is talking the talk. Let's look into this.
Right. So, the traditional cardiac catheterization, where they see if there's blockages in any of your main vessels, that's the standard. If somebody has a blockage, they get a stent or a bypass. But in women, they noticed that this subset of women didn't really have those blockages. Yet when these researchers looked further, all of these small networks of blood vessels that sort of surrounded the base of the heart were all sort of energized in a negative way. And it turns out that a lot of that is provoked by our neurotransmitters. And guess what provokes our neurotransmitters? Anxiety and excitement and worry. And so indirectly, while anxiety may be the underlying cause, there's actually a true effect on these blood vessels that are almost squeezing the heart.
Wow.
I just sat there sort of, listening the whole time saying, I never heard of this. And how come I've never heard of this? And I saw my cardiologist a short while after. I'm like, I learned about microvascular heart disease in women. And he said, oh, yeah. Of course, he didn't expand upon it. So I'm guessing he wasn't as enthusiastic. But for women, this really explains a lot of why was it triggered by an anxious event. And it's not just all in our head because we have anxiety, but a true physical finding is happening in the hearts of women's small blood vessels around their heart. Pretty cool.
Unbelievable. That's amazing.
The cardiologist that was speaking, of course, they were all women, so probably a special interest in why do women behave differently. And she really was just introducing her research, and she had me. I was on the edge of my seat listening, going, this is what happens to a lot of my ladies.
Yeah. Now, why do you think this is a trend now?
I don't know that it's a trend differently. I think we're just starting to say as women, listen, we're not different men. We function differently. We have different hormones. We are just built differently. So let's look for other causes. If you can't answer it in the traditional way that we know, then let's answer it or find a reason. And so these studies were done on the vascular system, and she would show slides of the network of these small blood vessels that were all sort of different in a woman's heart than in a man's. And so this sort of explains why we present very differently. And so the moral of the story was, don't dismiss women, or women, don't be dismissed. If you go to a hospital and you get the check mark off for not having a blockage, to keep looking further. And if you're well enough to go home, great. But if you're not well enough to go home, ask more questions.
Absolutely. Now, after menopause, because this was a menopause society, after menopause, we don't have the hormones that we need to protect ourselves, correct?
Right.
And I've heard that, like, diabetes in the family or any pre-existing or pre-diagnosed exacerbates. Did I say that?
Yes.
Exacerbates after menopause. So do you recommend that we go on hormone treatment? How do you prevent that from happening?
So the answer is maybe, and it depends. And the reason why is because last July, the FDA lifted a boxed warning that were on hormones. And so now the whole world is reconsidering their hormone therapy. So if a 72-year-old comes into me and she's been 20 years menopausal, and all of a sudden she's learning the benefits of hormones, probably too late, especially in regards to cardiovascular health. But if you read some of the different Instagram and TikTok videos, you would think it cures everything. Listen, I love hormones. I think there's a lot of good, but you have to individualize the care and hear the history. If a woman is within the first 5 years of losing her hormones, either surgically or menopause-wise, great. That's a great candidate. And maybe she will have a beneficial effect on her heart. There's a lot of debate in the cardiology community and in the OBGYN community and hormone space. But we think that if you start it early in the first 5 years, that you maintain some of the elasticity or stretchiness of the blood vessels, and therefore they can accommodate our anxiety and our stress and stretch instead of creating a problem. But there's also some studies that say after you're 10 years without hormones, then starting them may be a little bit dangerous maybe a little increased risk for a heart attack or a stroke. But if you're lucky enough not to have had a heart attack or stroke, by the time you're on for 3 years, you may have gained some more benefit. So that was a large study in 2002, the Women's Health Initiative. And there's lots of argument out in the community of providers that says, oh, but that was oral estrogen and we give transdermal. Okay, that's getting way too much in the weeds. Mm-hmm. The moral of the story is talk to a menopausal physician that is talking to you about science and your particular risk based on your history, not anybody else's.
Correct.
Make it individualized.
Where do you see that biggest gaps in current medical training and practice that doctors overlook the fact that women could be having a heart attack, women could be having cardiovascular disease or something like that?
You know, it's probably a multifactorial. So let's just say it's the emergency room. What do those guys do? They're guys and gals. It's life or death. They're immediately trying to figure out the problem the minute they see you. It's sort of a fun game. What is she, if they have a student, they might be saying to the student, okay, what does this patient have? And then they run through their series of life or death labs and images and make a diagnosis. They're not there to solve your diabetes or your lifetime problems or understand who pissed you off today. They're just there saving your life. So if the patient only gets her care when she's worried or having chest pain in the ER and never follows up with someone who will sit with her, then it gets missed because they're solving a problem. They're not taking care of your everyday health. Yes, they'll fix your blood pressure briefly, but someone else has to follow that and make sure the treatment is continuing to work. So you really need a good cardiologist or a primary that's really engaged in heart health. Some really love it and some don't. If you get a cardiologist, you sort of want a cardiologist that stays current. Listen, I'm 64 years old and there are doctors in my field that are my age that stopped learning when they left school and they don't stay current. I, on the other hand, every time I'm challenged with something I don't know, I'm going to read an article and get back to you. Right. So you need someone who stays current. And the younger the doctor, the more current they've learned, right? Their regular learning is what's current. They're fresh out of training. So a new cardiologist might be really the best person to get a second opinion from, even if you have an old cardiologist that you like, because they're the ones that have the latest science. So thinking in that direction, getting referrals when you need it. Sometimes the primary doesn't like to refer you because...
I was going to ask you that.
Yeah.
They don't like to do that.
I know, because they don't want to be seen as not knowing.
Right.
And so if you have an insurance that doesn't require a referral, then be your own advocate and just get an opinion. You don't have to stay with them. Just go get an opinion. And today you can AI almost anything. So my recommendation there is
true.
To AI. Yeah.
Oh, I use AI for everything.
Everything. But you have, AI is only as good as what you ask it.
Right.
Absolutely.
And you have to know something about it or you'll be led down a path. But if you start with scholarly articles for hormones for heart disease, right? And it at least will get rid of all the marketing crap and all of everybody's fancy website that they're trying to sell you a supplement and take you only to the science. Now, it might be harder for you to read the science, but you can read the title and get the sense of what it's going to be about. And then you read the abstract or the beginning and the introduction and see what you understand. Most people can glean a lot of information about the gist of it. And then you take that and you go into the cardiologist or the primary and say, can you tell me a little bit more about this? I love when they do that.
Well, I mean, I think it's so important, period, for any women, especially when they get down to 50 and start menopausing, to also be able to get a clearance from a cardiologist. I mean, it doesn't take much. Just go and do your stress test and your whole physical and, make sure that you're okay. Maybe you're okay for the next 2 or 3 years. You know what I'm saying? I mean, I still think that women neglect to do that. unless they have a heart attack, unless they have chest pains, unless they feel there's something wrong. Then that's when they go to a cardiologist. I said, but I think that it should be more preventive.
But sometimes your insurance, you go to a cardiologist for a well checkup and they don't cover it.
Right. There is no well checkup with a cardiologist.
And then you go because you have a problem.
Right.
And sometimes it's too late.
Right. And here's some basics. So basic number 1, if your glucose is elevated, I don't care if you want to call it pre-diabetes or sugar elevated one time or borderline, call it what you wish, whatever makes you happy. Make it normal. I don't care what you call it. It's abnormal. Make it normal.
That's it.
Sugar, extra sugar in the blood causes acids that corrode the vessels. And so fix it. And it can't be just fixed for the blood work next week. It should be fixed all the time. And listen, I tell people all the time, stop eating breads, pastas, rice, or potatoes. And they're like, what? No brown bread? No bread. Just give it a shot. And, it teaches them how to control those sugars without going on dramatic worry. That's number 1. And number 2, the blood pressure. Every day people tell me, oh, it's just white coat syndrome. I don't dress in a white coat. I dress in a casual shirt in the office. I haven't worn a white coat except for pictures in a long time. So I know what they're telling me. I'm at the doctor. Potentially you're going to see me naked. I'm already nervous. I have to get on the scale. I'm really nervous about that. I get it. But the fact that your blood pressure is 180 over 109 today is freaking me out, and I want to send you to the ER. It's only because you have no symptoms that I'm letting you go home. But that patient could stroke out. So 160 over 90, a blood pressure of 160 over 90 is stroke range. Wow. Even if you just got there because you were excited with the driving in the rain. So normal blood pressure, and I'm as guilty as all of them at ignoring periodic elevations. Yet now when I have normal blood pressure, I say, this is how it's supposed to feel. Hey, when my blood pressure is a little elevated, I feel like I've had too much coffee, and I don't really drink coffee. And so respond to what your body is saying. Don't dismiss it. Sugar and blood pressure, easy.
Wow. And chest pain. You have chest pains. It's not always anxiety,
right,
or stress.
Right.
It's stress. I'm very stressed out. Check it out.
And for women, a lot of it isn't even traditional chest pain. It's really where the stomach is. It's midline and really over the stomach. So what do they think? I just have some indigestion, heartburn. So they go and lay down. And that's why women are more likely to die from their first heart attack, because they don't have those compelling symptoms that a man would, the crushing chest pain and the numbness in the arm and in the neck. They don't really get that. They get more of a indigestion type of feeling. And so they just, I'm going to go lay down for a little while. And so, you have to really stay on top of your screenings. But don't get overcome with all the marketing for the stuff people want to sell you. You can buy any test head to toe for about $4,000 these days. You can get everything done that you want. That's not necessary. Your insurance covers most of this evaluation with the proper diagnosis.
Be proactive.
Right.
In a nutshell, be proactive. Don't rule anything out.
Right.
You got to be very proactive. You got to be your advocate. I mean, we see it every day in our business.
Absolutely.
If you are not, even, I mean, can you imagine we have to follow up on everything for us? Can you imagine some of the elderly patients that we have? I mean, if we have them in service, we do it for them. But what about for those people who don't have that kind of support at home?
That's right. Well, we are a resource. They can contact us and we'll provide them for resources and everything they need. But this is it's a very interesting topic. And I have to say a story. I live with a very...
Doris. I love it. I love it. Don't you all love Doris? You got to send her a little email with an emoji or something so she knows you guys are listening.
So I live with a 70-year-old who is a addicted golfer. And he woke up one morning and he's like, I I don't know. I just don't feel that right. I said, okay, let's go to the ER. No. It's indigestion. You just said that. It's indigestion. I said, you look, you don't have color. He goes, no, I'm fine. He went to play golf.
Oh, shoot.
Came back from golf, had no color in his face. Said, you know what? I think I'm going to call the cardiologist and see if I could go in. I said, I'm going to go with you. No, it's no big deal. It's just a stomach ache and whatever the case may be. 20 minutes after, he goes, by the way, pick me up in the ER. I had 2 heart attacks and I'm taken to the ER. When we got to the ER, it was the Widowmaker.
The LAD, yeah.
And the doctor said he is alive because of a miracle. He had 2 heart attacks on the golf course.
Oh my God.
Yeah.
So don't ever rule out a little stomach ache or anything like that, because you know what? You could die.
And the message to you is you saw changes that were unhealthy, pallor, no color in the face, fatigue. And you just said, you know what? Your ass is going to get in the car and I'm taking you there and then I'll drop you off at the golf course on the way home. Because had he not advocated for himself and gotten lucky, then there might have been a different outcome.
Absolutely. Absolutely. Take care of yourself. You're number one. And especially the men listening, stubborn. Sometimes they don't want to go to the doctor.
yeah.
Shocker.
Yeah. Chris,
Now I'm
sorry,
fine.
we're attacking
Chris,
you.
we're attacking you because you're the man in the room. Yep. Come on. No, I'm fine. I'll get better just a couple of days. And the couple of days become dangers. You know what I mean?
Right.
Absolutely. So can you give us 3 or 4 tips that you recommend for women, because we're focusing on the women with a broken heart, that you recommend women when they have any kind of symptoms, what to do?
So let's start with prevention. How do you prevent having any of this? So if you are a newly menopausal lady, talk to your physician about starting on low-dose hormone therapy as a possible agent to preserve the elasticity of your blood vessels so you can withstand these changes. Exercise. There is nothing better for so many things than exercise. When you're riding a bike or getting on the elliptical or taking a brisk walk, a regular walk the dog, maybe not so much, but you want to get your heart rate up and challenge it. We all wear a tracker. We know what our heart rate is. You can calculate your maximum heart rate. It's 220 minus your age. And so whatever that number is, that's 100% of your maximum heart rate. So if you can get your heart rate to that and you don't get any chest pain, that's like your own stress test. But really, when you're exercising, you want to get to 80%. So I'm 65 minus 220. So 155 would be my 100% of my maximum. 20% of that, we're at like 130. So if I can get my heart rate to 130 and sustain it for 30 minutes, that's good exercise for my heart. And if you really are good and can spike up into the 150 and 160 range without symptoms, then you've done a little bit of extra stress and you're good. So exercise, low sugar, reduce the inflammation in your body if you have autoimmune disease or any kind of disorders that create inflammation. Watch the starches and sugars, blood pressure low, and visit your physician, a physician that is interested in all of you at least once a year, if not more often. And with any symptoms, report them to somebody, even if it's just a friend who will advocate for you.
There you go.
It's very good to be able to share. I feel this way, or, I'm tired, or this is what's going on. Sometimes some people have insights. Hey, did you do this? Did you check this? It's very good to bounce things off each other, especially through friends. But you're right. My doctor does it. I do go and do my physical every single year. And I do everything from mammograms, everything, women, heart, everything, every year. Women has to do it, especially after 50.
Well, you're starting to see, especially in this area of Palm Beach County, emerging these concierge practices.
Yes.
Back in the day, they were sort of not frequent, and people were like, what? I'm going to pay a couple grand a year, and I still go and pay my copays and deductibles. But the evidence shows that in these concierge practices, because they spend so much time with the patient at every visit, because they're seeing fewer patients, and they have a contract, if you will, that the patient can make a call and be seen within 24 hours. There's no delay. Nobody's dismissing you. You have a phone number for the doctor. It's a burner phone, but nonetheless, it's a phone number that the doctor responds to personally. There is something to be said to have that kind of personalized attention, especially on a weekend where you're not sure. So if someone's budget allows it, then find a concierge doctor in your area, because the evidence shows that they are able to, based on the way the practice is designed, to give you more time. And certainly if you're a patient with complex medical issues like diabetes and hypertension and hypercholesterolemia, et cetera, then you may really benefit from those.
And you're right. If you can, it's the best thing in the world.
And if you can't, there's still some really good internal medicine physicians
Yes, there is.
that will really still toe the line the same way. Has anybody had a CT angiogram? A CT angiogram. So they push a beta blocker. So they push a medicine in your arm, a drug, to slow down your heart rate. You're laying on the CAT scan table. And then they put you through and sort of like a live video of your heart. And the drug slows down your heart rate. And you would know if you had it before, because when they give you the drug, it feels like you're peeing your pants. Because they would warn you, and I'm like, what? And I'm like, oh, wow, that's weird. But that's what the sensation is. And you almost want to check and go, did I? Because it sure feels like it. But anyway, it looks at the circulation, and it measures both hard and soft plaque. So people know about a calcium score is hard plaque only, and it's a number, it's a score. And then there's this angiogram is soft and hard plaque, and they can see if there's any narrowing as the blood is going through the vessels. Sort of cool.
I've done
and
that.
It takes about 15 minutes.
Yeah.
They offered it at all the imaging centers. It's covered under the insurance, but I had one of those last year. He's always doing something new. And they're all like non-invasive stuff. So it's not scary. And it's not invasive, and it doesn't take a lot of time, and there's no out-of-pocket or minimal out-of-pocket. And so these are things we can do to be proactive about our health.
So what if they tell us we have an obstruction or something like that?
Then you go a little further. Then you probably have to go to get the real cardiac catheterization with the dye, so they can really watch all the areas. But it would go to the next level of testing. So usually if you, let's say, fail or not fail, but have suspicious findings, then you go to the next level test. If you fail, let's say you're in the angiogram, they'll then put a stent in, right? So when they're taking a look on the cardiac cath, they'll do a stent. If they can't get a stent in, then you get a bypass. Or if there's a lot of vessels or a hard vessel to get to, like there's one called the circumflex. It's sort of, you can't bend anything in there. Thankfully that's not really women. Although women get stents.
Yes, they do.
Thankfully not too many women need bypasses.
You know, sometimes this is primitive, okay? Sometimes it's better not knowing than knowing. Have you ever heard of that?
True. A lot of people function like that in life.
I'd rather not know if I'm going to have this or that, and that way I'm okay.
Right.
As soon as I go in there and they tell me more things will happen and everything goes down the tube. So I don't know. It's an old mentality that's wrong, completely wrong.
Right. But you know what? If everybody lived forever, we wouldn't have enough resources. So
That's right.
People just have to die off.
Oh my God.
Put that one on there.
That is too funny. Okay.
Well, thank you so much, Dr. Whelihan, for coming once again and always with amazing, incredible information. We are so grateful that you spent some time with us. But please tell us, how can people get a hold of you if they have questions, or if they want to talk you to come on the show and talk about anything, or please share with us.
So the office website is mygynpractice.com. And for new patients or existing patients, but the existing patients already know this, there's a little toggle button up on the upper right that says book online. And so they hit that, and then you see who the practitioners are in the office, and you get to select. People go nuts because, they look out 4 months and there's no spots for me. What? Is she not practicing? I'm really just booked out 4 months. So you can always call the office, and the phone number is also on the website. So that would be probably the best way. On LinkedIn and Facebook, I'm always posting fun things for just education, especially on LinkedIn. So people can go into my posts there and just read fun things about the topic of their choice. But just make sure you ask somebody and have them take good care of you.
Well, thank you. You are amazing. And we love to have you. If anyone is interested in any other topic that you would like to hear, or you'd like to come on a show, no matter where you are in the world, please email us at seniorcaremade-simple-podcast@gmail.com. seniorcaremade-simple-podcast@gmail.com. Thanks, everybody. Have a wonderful rest of your day.
All right.
Senior Care Made Simple, an elder care podcast, has been brought to you by Horizon Care Services, your private duty choice in home care in South Florida. For more information on acquiring home care assistance, visit horizoncareservices.com.